we discuss the opioid crisis with North Carolina healthcare, insurance, and law enforcement leaders. Next.
A Crisis, North Carolina's Opioid Battle, is a production of the North Carolina Channel in association with the North Carolina Department of Insurance.
Hello, I'm Kelly McCullen. Fighting North Carolina's opioid epidemic will require teamwork between state policymakers, local substance abuse and recovery professionals, and loved ones of those affected by addiction. Insurance Commissioner Mike Causey, Health and Human Services Secretary Dr. Mandy Cohen, our state's Attorney General Josh Stein, SBI Director Bob Schurmeyer, and North Carolina's Director for the Federal Drug Enforcement Agency, William Baxley, are here to discuss this opioid fight, from the war on drugs to the personal battle many people face when painkillers become addictive. But first, epidemiologists say this wave of opioid misuse and abuse is quite unique, but has existed longer than you might imagine. Humans have used opioids since ancient times, but this 21st century opioid epidemic is something different, a modern problem where the medicine itself is creating a crisis.
There are statistics that show the number of lives lost in the tens of thousands. And here in North Carolina, we lost 12,000 individuals to opioid overdose between 1999 and 2016. That's a lot of lives lost, and the economic impact is sizable as well.
So I think we have to understand why people are putting these substances in their bodies, right? So there's reasons of pain, there's more surgeries happening, people are surviving from cancer more readily. There's people who are much more obese than they were and putting more wear and tear on their joints, right? People are living longer. All these things mean that there's a lot of baseline need for pain control.
Experts say our modern-day opioid crisis is rooted in the legal prescribing and usage of opioid-based painkillers over the past few decades.
In 1980, the Jimmy Carter White House was talking about how prescription drugs kill 7 out of 10 Americans who have overdose deaths. In 1980, the number one drug prescribed in America was an opioid.
Researchers like RTI's Dr. Lauren McCormick are studying the long-term use of opioids by humans to treat chronic but non-life-threatening pain. Early research suggests these opioid patients may not fully understand the risk of addiction.
This has been around for a long time, but now it's really escalated, and the concern is there. We just need to attack it in a multidisciplinary way. Lots of players is the only way we're going to do this: government, research, industry, and private sector partners.
We've heard from the researchers and the epidemiologists about the opioid crisis. Joining me now, 2 experts in this field, or well, I would say policy experts in this field. Josh Stein, North Carolina's Attorney General, Secretary Mandy Cohen, Dr. Mandy Cohen of the Health and Human Services Department. Thank you so much for coming on.
It's a pleasure. Really appreciate you doing the show.
Talk about this issue, Mr. Stein. It seems to have snuck up on us. All of a sudden we have an opioid crisis in the past 5 years. How did it happen?
Well, it's been 20 years in the making. If you look at it essentially from the mid-90s, there's almost a direct relationship between the amount of opioids that are prescribed by doctors and dentists and the number of people who are dying from overdose deaths. And addiction is the exact same trend. There are a lot of factors that came to play that explains how we got to this point. There was marketing by pharmaceutical companies that was very rosy about how effective they were for dealing with pain and how they were non-addictive, when it turns out neither of those things are particularly true. People were demanding their doctors to make their pain go away. And in fact, doctors in hospitals were being evaluated on how effectively they treated pain. And so there were just a number of things that came together that led to a vast overprescription of these pills, which, as I said, leads to overdose and death.
Doctor, how does it work when the doctor gets between the medication and the patient who's demanding a pain-free lifestyle, or at least some relief from some condition, using an opioid?
Where the Attorney General was, I think this was a path paved on good intentions, right? It was doctors like myself wanting to control pain for our patients, and patients having real pain. But what I think where we got out of whack here was not having a real conversation about being pain-free, or are we going to control pain? I think that's a thoughtful conversation we want to have with my own profession, and we're starting to think through and have better guidelines about how to prescribe these medicines. The CDC has been a leader on this and putting out guidelines guidelines for my fellow doctors. We've done a lot here in North Carolina to make sure that we can put some rules and regulations in place to help guide folks as they're making decisions about pain treatment. But I think what's happened in the last few years is we're seeing a shift away from the pain pills, and we're seeing more and more folks die from what they're buying on the street, heroin and fentanyl. And that's where we're seeing a skyrocketing number of deaths. And so it's important to talk about the pills, because I think that's where it starts, but really also need to think about those illegal drugs that folks are getting on the street as well.
Over the last 2 years, more people have died in North Carolina from overdosing from heroin or illicit fentanyl than prescription painkillers. For 15 years, the majority of people who are dying were overdosing on the pills themselves. But people get hooked to the pills and then transition. 80% of people on heroin started out hooked on the pills, but sad reality is heroin is cheaper and more plentiful on the street than the prescription painkillers.
How good is policy in fighting street drug? We get the pills, you can regulate pharmacies, you can regulate doctors, we'll talk about that later, but how good is a law?
Well, our laws can continually be improved, and my office has put together a task force of law enforcement that's federal, state, local, prosecutors and law enforcement officers to identify what gaps there are in policy and training so that we can both stop the diversion of lawful painkillers into the illegal drug trade and the flow of illicit drugs into our state. And folks are working hard. I mean, the DEA, the SBI, they are working tirelessly to try to keep these drugs at bay. But I think fundamentally what we have to do is stop new people becoming addicted and treat those who are addicted. And if we can do those things effectively, we can turn the tide on this crisis and save people's lives.
But Dr. Cohen, people want to feel good. They go to their doctor because the doctor makes things better. Opioids can make life better for a lot of people with aches and pains. What would you say to doctors that are following these laws that are being passed, and what's the proper way to behave professionally when dealing with a patient?
Yeah, I'd say pain is real and we have to treat pain, but there are a lot of ways to treat pain other than just through opioids. For example, we've changed a lot of our rules in the Medicaid program about what the Medicaid program covers in terms of treating pain. So go beyond just an opioid, something like a Percocet, and do things like an NSAID. It's a stronger version of Advil. And look at other modalities, whether it's chiropractic, acupuncture, yoga, right? We really need to start to think very broadly about what are the things that can help to treat pain. And I think importantly, knowing that there are a lot of folks who are addicted to these medicines is making sure that we're treating it like the chronic disease that it is, right? We treat diabetes with medicines, we treat high blood pressure with medicines, we have to treat opioid addiction with medicines as well. And we have great medicines to do that, but again, we need to make sure that folks know what is available to them in terms of treatment options, and we have to make it affordable for folks to get that treatment.
Do you feel the state is now in a proactive position against opioids, or are we still reacting to what's happening at the ground level?
Both. The communities are struggling to deal with the consequences. I've held more than 20 community roundtables in urban, rural, east, west, Piedmont, to hear what's going on at the local level. And first of all, I just want to say how inspiring it is to see these folks who are dealing with the consequences at the ground level, whether it's jails being filled up with people, the emergency rooms being saturated, social services and foster care being overloaded. They're the ones who are dealing with it, and they're coming up with some really good ideas. But the state recognizes this as a real problem, and we are working together collaboratively, the secretary, the governor, and other guests who are going to be on the show later. We all have come to the clear realization that people are dying. It's probably the gravest public health, public safety crisis we face in North Carolina, and we're doing everything in our power to develop effective strategies to attack it.
I'm glad you brought up the communities, because we've been out looking at the state, following leads. Your office has met some great people and told us about them. One was in Nashville, North Carolina, where state leaders, you can make the broad policy decisions, but it's the first responders like EMTs, firefighters, police officers who are dealing with opioid abuse and overdose cases face to face. Nashville's police chief, Tom Bayshore's face-to-face experience with substance abuse has sparked an idea he's calling the Hope Initiative. Our producer Emily McIntosh, videographer Alan Brown traveled to the small town to tell his story.
Our job is to arrest individuals that have possession of drugs. We put them in jail because that's what, we're supposed to do. And hopefully somebody would take care of the problem once they got into the jail system or into the court system. And so it was painfully obvious that, that was never happening. So the Hope Initiative is a program that allows individuals to come to the police department voluntarily. If they have drugs or paraphernalia on them at the time they come in, they can turn that over to us, no questions are asked and no charges are filed. We just take it and destroy it, and the emphasis is placed on getting them into recovery programs. There have been more and more law enforcement agencies, I think, now are recognizing that this is a serious problem and that we have to do something to help our citizens because it's definitely not going away anytime soon.
Bob Schurmeyer, the director of the State Bureau of Investigation for North Carolina, here to discuss opioids and opiates throughout our state.
Right.
Give us the lay of the land.
Well, North Carolina, like so many other states, suffered from the perfect storm of opiates and opioids flooding the market. I agree with the Attorney General that it started with legitimate prescriptions oftentimes, but it's evolved into illegal drugs as well. And so North Carolinians should understand a couple of things. We lose 5 people in our state approximately every day to this terrible problem. 5 people. This crisis comes at a cost estimated to be $1.2 billion a year to North Carolina. It's a huge cost to us in human toll, but also financially. So people should understand that we've got committed agents working 24/7 to deal with the diversion issues that come up, agents that work on Operation Medicine Drop, but we also have agents that work very effectively with our federal partners, with DEA and FBI, and also our local partners at the sheriffs and police departments across the state. And we interdict, on the supply side of things, we interdict kilos of drugs every year. So I would send this message to the cartels who are involved in this. Come to North Carolina and you're going to meet our agents. We're going to put you in prison where you belong. So we want to send a clear message to them. Our agents are also committed to the prevention and education side of this, and we will do what we can do there. And we're also committed to the treatment side of things. We are not out there arresting people that treatment is the best answer. We're out there taking off kilo dealers and other people that deserve to go to prison for a long, long time.
How has the opioid crisis affected the war on drugs in general? Is this a different kind of drug? Epidemiologists seem to think so.
It is. It is. And the best indicator you have are the people that are being victimized by it. I mean, we're seeing people die again in places that sheriffs have told me in rural parts of the state they've never seen anything like it. They've seen people die. They've had their deputies and police officers incidentally exposed to this sort of drug, and creates a huge issue for law enforcement and first responders. So it is different. You know, methamphetamine was one. It had its set of risks, but this is a whole different game for us.
Bob Schurmeyer, State Bureau of Investigation of North Carolina. Thank you, sir.
Thank you so much.
A lack of quality mental health services can make a difference between some people staying healthy and some seeking relief through opioids. It's a link that addiction professionals are aware of, as is the team at the North Carolina Department of Insurance. It has set up a toll-free number if you need help paying premiums for mental health care. It's 1-855-408 1212. Write that number down. It's a potential difference maker, and it's toll free. 1-855-408-1212. In Columbus County, North Carolina, leaders are dealing with the multiple challenge of both opioid abuse and a lack of quality mental health care services. The Columbus County newspaper, the historic News Reporter, is capturing digital and written stories and partnering with Scallywag Magazine to raise awareness of the links between mental health care and opioid addiction. The News Reporters Caroline Hensley and Jenny Clore tell the story.
Well, since I've been here for the past 3 years, we've seen an increase in opioid overdoses that present to the emergency department. We've gotten calls from outside EMS for resuscitation of opioid overdoses, and a lot of people who come into the ED are actually seek opiates just as part of their addiction, so we've seen an increase in that. As far as repeat patients, we see a lot of, on both sides, mental health patients who repeat, enter in and out of the system, and opioid patients that come in not so much after they overdose, but more of drug-seeking behavior to try to get prescriptions for narcotics.
Very rarely do we go to a first-time overdose. Most of the time it's to repeat folks who have overdosed before, and they continue just to get worse as the time goes on. We tend to see a lot of initial damage, with the person who's involved in the overdose, as well as a collateral damage, which goes along with the family. But the resources that Columbus County has for addicts is very limited, I believe, and I think that a lot of leaders would agree when we're having this discussion.
I feel mental health is a huge problem in culture and society right now that it is underaddressed. A lot of people are just trying to self-medicate with prescription medications because they don't have the insurance or they don't have the resources to actually get the proper mental health treatment that they need.
Now, it's kind of forcing us to have to deal with the problem because it's something that's not going to go away on its own, I'm afraid.
Mike Causey, Insurance Commissioner. First responders. Bayshore is one of them over there, and he's doing something different. What are they telling you on these tours you're going on to? How are they fighting opioids across the state?
Well, as you know, the first responders get the first calls, and unfortunately, I've talked with fire chiefs around this state that have gone to repeated calls to the same house or the same person. I talked with one chief last summer in the middle part of the state that had revived the same person 14 times in the first 6 months of last year.
14. I've heard of multiple times, but never quite.
14.
Mr. Baxley, William Baxley, audience, I should tell you that he heads DEA efforts for the federal government out of Charlotte. He's a statewide director. And you have a different approach. Is the DEA a first responder, or are you something more than that, or bigger than that?
Well, we're not a first responder, but we do a lot of training with first responders because that first response is critical. When you respond, when an EMT or police officer responds to an overdose death, they're actually going into a crime scene. So when we start building a case, whether it's something that we want to prosecute as a homicide or just the drug case itself, that first response to that scene is actually going into a crime scene. So that takes a little education and a little awareness to let people know that, because the medical professionals are going in to treat a medical condition, so it's not their purview to start an investigation. But that initial step, that first response, is critical for us to start that investigation so we can start working our way backward to the supplier and ultimately the source of that.
So it's easy to overlook. If you're a local, you walk in, someone has passed away or someone is not breathing, you have an acute situation here. It's easy to not think crime scene first. Maybe you want to try to help first. Does that ruin the scene if you go in first trying to save, whether or not it's successful or not?
Well, it certainly can. Ultimately, our primary goal is to save lives. So we want those first responders to do what they need to do and not worry about that crime scene. But we also want the awareness to be there so they can start working back. So preserve what we can preserve and gather what evidence we can gather at that point. And that's just awareness and a few extra steps. But that's something we're trying to work with our local partners on through training and just education and awareness to make them understand that that is actually a crime scene.
When it comes to a case, an opioid case, or any kind of substance abuse, there is a crime scene potentially there. I guess illegal drugs are being used. So how do folks under your watch, how do they exercise the common sense factor of we have a healthcare problem here versus we have a crime that's been committed?
Well, we do have law enforcement under the Department of Insurance in our Criminal Investigations Division, but generally for most of these opioid calls, it's the first responders that are going out there, and oftentimes if there is a death, they'll have to call in the local law enforcement, the sheriff department, or state law enforcement, SBI, or so forth. But we, generally, the firefighters that I talk with have not been that involved with the death scenes.
But dial 911, someone isn't breathing, they're having a hard time because of a substance overdose. Now you're talking about fire departments.
That's right, they're the first responders, absolutely.
Do they have what they need to save lives in this state?
They do. They have, most of these fire departments have Narcan, which is quite expensive. And when we talked about the firefighter that went out and revived the same person 14 times, you think about the cost, the total cost to the taxpayers of that type thing. But they do, some of our fire departments have some of the finest equipment available. Some of our smaller rural departments need help with some of that equipment.
As you tour around, are there areas that are better equipped than others to handle the opioid crisis? Where needs help? Where's doing it just right, in your opinion?
Well, I can tell you our small rural counties generally are the ones that need the most help. You know, your major cities, the fire departments in Charlotte, Raleigh, Greensboro, they're all well equipped. But you go to some of these low wealth counties, the fire departments are struggling, because they're struggling to recruit volunteers and they're struggling to retain those volunteers. And the volunteers are, many cases, they're on the roster of a number of different fire departments. So you'll have first responders and firefighters out here that are working 2 or 3 days in a row with no sleep or rest. And
they have to be trained.
And so it takes a considerable amount of training. That's correct.
When do federal agents care about a call such as that? When does it overlap? Because they're trying to save a life, and we'll handle the legalities later. You sound like we're about the legalities. Is that accurate?
Well, sure. I mean, obviously, we're wanting to get the source, but it starts with the user, who they're getting it from. They're actually going in, talking about our first responders, are going into a lot of times a hazardous situation. One of our biggest concerns nationally now are training first responders so they know when they go into a house that may have powdered fentanyl, that is hazard. One small speck of that can kill you. And a first responder can go into that not understanding that they're going into a deadly situation with those drugs there. They don't know what they have. So they go into where they have someone that's obviously OD'd. They're on the ground, but the drugs are spread out, and those drugs through touch, through inhalation, can kill you. So it's important that nationally we have had episodes where first responders have had to be rushed to the hospital or revive themselves because of contact with that.
It sounds like a dance, a partnership that people often overlook. We're over in the east with Chief Bayshore, but over in Greensboro, they're doing some great things. Guilford County reported over 600 opioid overdoses in 2017 alone, gentlemen. There's a new team there that's working in the Triad region. They're helping opioid abusers, get this, after they've been saved from an overdose.
I'm the Rapid Response Team Navigator for the GC STOP program, which is the Guilford County solution to the opioid problem. The unique part of this program is the main way we identify people is people that have already overdosed. A big part of all of this is meeting folks where they are and getting out into the community and talking to those directly impacted. A lot of times when talking with people the first time, you can kind of tell it's the first time that anyone's been kind to them in a really long time. Folks don't get a lot of kindness that are using substances. So it's always great to see that and to hear about people being revived. So hearing about those reversals is, really important to me.
Chase Holloman and the team working out of Guilford County, Attorney General Stein. Well, let's talk about the STOP Act. Legislators are paying attention to what's going on out there. They gave all of you a law to help fight opioids called the STOP Act, passed in late June of 2017. You're the attorney. Explain this law in a way we all can understand it.
Sure. Basically, to deal with this crisis, we need to have a comprehensive approach. You need to focus on prevention. You need to focus on treating people who are sick with substance use disorder. You need to focus on enforcement. And enforcement is really two things. It's both going after the bad guys who are trafficking it, but it's also using innovative strategies like Chief Bayshore in Nashville. The prevention side is about trying to keep people from becoming addicted in the first place. And that's what the STOP Act is all about. It tries to reduce those people through smarter prescribing by doctors and dentists. And it does it in three main ways. The first is it sets a limit, according to CDC recommendations, of how many days when somebody has acute injury. You break your arm, you get your wisdom teeth taken out. It's not something that's chronic and long-lasting. When you have that injury, the maximum they can give you is 5 days. Now, it used to be if people would go in and get their knee surgery, they might get 30 days, 60 days worth of pills. And either the person would get addicted in the first place, or they would put their extras in the medicine cabinet where somebody with addiction or a young person who's making bad decisions gets their hands on it. So the STOP Act sets a limit on the number of days. It also requires doctors to use a database that's called the Controlled Substance Reporting Service so that they can know when a patient is doctor shopping. The patient may say, look, I injured my knee and I need help. Yeah. But if you go to the database, you can see that they've gotten prescriptions from 2 other doctors.
Well, you've set up Dr. Cohen perfectly. Doctor shopping, is that popular? It sounds like it's someone who's trying to get multiple prescriptions all across town or all across the county. Is that accurate?
Yeah, so I do want to make sure that I commend the Attorney General and his leadership with the STOP Act and getting that passed, and the continual focus and effort that he continues to bring to that, because that law is something that our department is implementing right now to get at just what you're talking about, that doctor shopping, and using this database and using that so that we can see what prescriptions someone can have access to. And just a couple weeks ago now, we were able to connect our systems to our surrounding states. So now we not just have data within North Carolina, we can see if someone's maybe crossing state lines as well.
A.G. Stein discussed smart prescribing. I bet I can't find a doctor in North Carolina that says they were dumb about how they were prescribing drugs. What does that mean? Because doctors generally want to work in the good faith.
Sure, and I think that everyone was trying to work in good faith. It was just a lack of training. I remember when I was first training as a physician, OxyContin was marketed to me as the miracle. Get pain-free and it's not addictive, and we've obviously learned that that's not where things are. And so, what we are using are all the tools at our disposal to say, hey, we got to do something different here. We're in a crisis mode, we have already seen a change in the prescribing patterns. We've seen a 30% reduction in the number of opioids prescribed through our Medicaid program. That's a tremendous amount of work. I compliment the STOP Act, but also the Board of Medicine and frankly the profession of medicine for taking up this issue and recognizing we have to, not that we were done before, but we have better evidence, more data now, and we need to respond to that.
Let me just tell you, there's a hospital, Ortho Carolinas in Charlotte. It's a orthopedic hospital. And they were concerned about all the opioids that were being prescribed. In fact, the one doctor who is leading this study had a very tragic experience with a patient who became addicted through his own prescriptions. And he said, we've got to have a better way of dealing with this. So he's doing a study, and what he's finding is that if you use non-opioid pain regimen pre-op, during operation, and post-op, it's not only not addictive, but it does a better job treating the pain.
But I want to ask you, Mr. Causer, you bridge the gap. I'm a patient, I have insurance. The doctor's spoken, the policymaker has spoken. How does this affect business? How does this affect my bottom line? I'm paying premiums, I'm paying copays. I'm asking for drugs and asking your insurance companies to pay for them.
The insurance companies, I know Blue Cross and Blue Shield monitor closely the prescriptions that doctors prescribe. So if you have, and if they have an outlier, some doctor that's over-prescribing, they're going to see that. It's going to be on their watch list. But it's certainly, we're all paying for it. If you've got some doctor or anybody over-prescribing and the insurance companies happen to pay for that, we're all paying for it.
And the Secretary has a payers council where she's working with insurance companies under the Commissioner's regulation, where they're just figuring out what are the best practices.
Sure.
What should we have that helps people deal with pain that doesn't involve opioids? She mentioned some of the different types of treatments there are. And for those people who do have addiction, we need to have effective treatment for them. What does that look like? Medication-assisted treatment, what are the best practices there? So insurance companies are recognizing they've got a role in solving this problem as well.
It's one thing to be at the high level making policies. It's one thing when you're battling within a family, private home. And for people trying to save a relative from addiction overdose, it can feel like a very lonely mission. Emily McIntosh, our producer, met a lady named Heather Moore. She's a mom. She saw a need to help affected families, and she, in fact, did something about it.
My name is Heather Moore. I am the founder of the Anchor Holds, Inc. Family Support Group out of Nash County, North Carolina. I realized that with everything that I went through with my two sons, that I needed help here. And I knew so many parents that had issues with substance use disorder with their children. I knew kids that had passed away in Nash County. So one faithful morning, I was talking to a friend, and the Anchor Holds, and we came, did this, and started an online group. Right now we have just about 500 people on the group, the support group, and it really is for support. We share stories, we post, helpful things that'll inspire, and if they have questions, if they need resources. I found that if I could help my kids, maybe I could try to help other people's children too. We can't just sit around idly watching our children die. We can't sit around just, not doing anything and just, throwing our hands up in the air. This is serious, this is happening, it's getting worse, people are dying. I didn't want to see another child die from a substance use disorder, and I didn't want my children to die from a substance use disorder. And that's where my passion is, that's where I feel strongly about, is trying to save the lives of these people that have suffered from this disease.
The Research Triangle Park Foundation, through The Frontier, recently held a discussion on opioid addiction and how opioid abuse has changed many people's perspectives on illegal drugs, from an activity linked mainly to street corners and dealers to a system where the legal and prescribed use of painkillers can cause addiction and crime. Experts say the opioid crisis is changing how many people in our society, from the private citizen to the politician, are viewing drug abuse and the concept of drug dealing.
Instead of focusing on drug dealers on corners, we're talking about pharmaceutical company executives in suits and physicians in lab coats as the ones who overprescribed or pushed prescribing so that people got addicted.
Research shows that while opioid addiction can afflict areas of high unemployment, long-term opioid usage in affluent areas with prime medical facilities means this crisis can affect anyone, anywhere.
It doesn't know any boundaries in terms of the people that it's affecting. It knows no boundaries in terms of age, race, demographic characteristics.
But if this opioid crisis can change our society's perception of drug addiction from being a character flaw into a treatable medical condition, it might help addiction professionals in their mission to help substance abusers seek help, get clean, and stay clean.
We have medicalized addiction. We have started calling it a brain disease. We have really said that it doesn't matter what the outside looks like, it just matters like what the middle of your brain is doing on a chemical level.
We see so much of the negative impact of addiction. We see it in the news all the time. We don't see the recovery stories. And the thought process behind that is if we put our stories out there, the success that we've had in recovery, it will help draw people out of the shadows.
Beating substance abuse, especially opioid abuse, requires a relationship. Doctors and professionals play their key role, but many people are in what's called sustained recovery. These people have a unique position and credibility when it comes to convincing people to seek help for substance abuse.
The peer support group here at Southlight Healthcare, we're a unique service, just like the other services here at Southlight, where we are a group of people who are in recovery from mental health or substance use disorders who work with individuals, clients here at Southlight and in the community on an individual one-on-one basis. So our goal is to walk side by side with people and maybe help alleviate some of those fears and lack of knowledge.
I was able to talk to other people that was experiencing somewhat of the same feelings that I was going through. We were able to talk and discuss things among ourselves so that we were in a position where we could get feedback from someone who maybe not just been educated, but someone who was actually living the experiences that I was actually going through.
Peer support hits home for me because I'm personally in recovery from mental health and substance use disorder. And it allows me to really use my personal experiences and my education to provide a service that people might not be aware of is out there, but can really help a lot of people who might not engage in formal services and get the treatment they need access to it.
One aspect of the opioid battle is that people can begin with a prescription drug they legally obtained and then find themselves in trouble down the road. And that's the topic I want to talk about with Bob Shermeyer and William Baxley, DEA, State Bureau of Investigation. Is it really that slippery of a slope? It could be completely legitimate to start and you find yourself addicted.
It absolutely is. The breadth and depth of this problem oftentimes begins with legitimate prescriptions and then evolves into doctor shopping or prescription fraud or forgery, but oftentimes it ends up on the street with illegal drugs.
What are your teams seeing out there in the general sense? You think of street drugs and cocaine and maybe marijuana, but heroin. You're seeing pills now? You're seeing fentanyl?
Absolutely. It's one of our biggest concerns. Nationally, the Drug Enforcement Administration has actually increased the priority of fentanyl as one of our major concerns nationwide, along with heroin, and they go completely hand in hand. So for the first time ever in 2017, we actually saw a decrease in the amount of legal opioids that were being prescribed to patients, which is a great first step. But on the other side of that coin, we're seeing a huge increase of illicit manufacturing of opioid-based products, most particularly fentanyl. So someone could order in a kilo of fentanyl from China, get it in the mail. They're ordering pill press machines, and just here in North Carolina, the director and I have seen an increase in pill presses being ordered where they're actually making their own pills now. So that's an alarming trend for us that we're trying to get ahead of, but it's something that's definitely we're seeing more and more of.
As two people who fight the drug war and just law enforcement in general, when you hear the pill presses being bought, you know people are making them to take them, and you know what fentanyl has done to celebrities. It's made headlines. Does it make you mad as someone who's got to enforce this, or do you look at it and go, oh my goodness, this is a strong drug to be out on the street?
Well, when you know how powerful it is, it's frightening. It's the equivalent of having explosives on the street. It's so volatile, especially the fentanyl, and it's something that is being put in the hands of untrained chemists to manufacture and then distribute it. So yeah, it's very alarming for us. It doesn't make me mad, but it certainly scares the heck out of me.
How does it work at the street level with teams trying to take this off the streets? Is it, are you likely to find a bag of pills on someone? Are they selling it in powder form? For those of us who just aren't in the space, what does it look like?
You see it in all forms and varieties. I mean, you see the pills, you see the powder. But it's a scary proposition. It's a scary proposition to law enforcement and, as you've mentioned, first responders who come up on the scene and end up with these accidental exposures that can ultimately kill people and disable them. It's a huge risk to the people at large. We talk to people who have rented houses that were actually labs at one point and exposed to substantial risks there. So it's a huge problem. It's still a growing problem. It scares us, but it also motivates Bill and I to get our agents involved and go after these the suppliers, interdict the suppliers.
I mean, the media brings up headlines, they take them away. I remember 10 years ago it was crystal meth, and you had the meth house that would blow up if you walked in the wrong place at the wrong time. How does this wave of opioids compare to crystal meth, compare to the cocaine of the 80s and whatever came before that in the 70s and 60s?
It's worse than anything else we've seen to date.
But why?
Because it is so volatile. It is something that can be easily obtained, and a low level of knowledge to manufacture the pills or the powders. They're coupling it with heroin now. So just because it is so lethal, it's a game changer for us.
And I would also say this, that the pills that you already mentioned was sort of the gateway into the opioid crisis, the opiate crisis. And so we now have a gateway from legitimate pharmaceuticals now into illegal drugs. Methamphetamine really didn't have anything comparable to that. So we've found and we've seen that this involves all spectrums of our society. In the past with methamphetamine, you could generalize and see what group of people that might affect, but with this one, it's so broad and so deep that it worries us.
Do you see a different customer? Because agents watch houses, they watch dealers. Is it just you're apt to see anyone walking?
Full spectrum.
Is it people wanting recreational drug choice, or is it people who are injured, have been cut off from their prescription, and they're going to get pain relief however they see they can do it?
Well, you have a small segment where it's people that legitimately were prescribed pain pills and then went to the next level. But overwhelmingly, the people that we're after now are the ones that are using it, start out recreationally, or using it as a true drug, not for any medicinal reason. So it started being acceptable based on the prescription. And now it's morphed into something completely different. And again, that's the reason we consider it an epidemic, and we are so alarmed about it.
And I want to play off Mr. Baxley's comment that more people are facing opioid addiction now, unlike what these experts have ever seen. But also statistically, the more that face opioid addiction, the numbers suggest people are beating opioid addictions as well, just in sheer numbers, and getting their lives back. So for many people, that means they go back to work or they attend college. UNC Greensboro is nationally recognized because it recognizes some students need a space where they can go to school, get their degree, and avoid all the temptations often associated with a college life. They have a small program right now. I don't know if you've heard of it, gentlemen. It's called Spartan Recovery. Small program, but a big deal to the students who participate in it.
We are a collegiate recovery community that exists to support students that are in recovery from alcohol and other drug addiction in their academic pursuit, and offer lots of different opportunities for peer support.
The Spartan Recovery Program is we're like a big family. We hang out and we socialize. It's kind of a really cool support group for me.
What we know is that a college university campus can be kind of hostile for someone who's in recovery. And now with collegiate recovery, students don't have to compromise their academics for their recovery or their recovery for their academics. They can have both.
It's like my sounding board here on campus. I know that if I need something, I can come here, especially being a person who was in school before and flunked out, and I was never able to complete it because of active addiction. But now being here and I'm clean and I have all of these support systems in place, it's just really given me the chance to be successful.
If I could have, one message to the public, it's that collegiate recovery communities are important. Our students matter, and they're being super successful. We're selling hope, we're selling the truth that people do recover.
Law enforcement leaders and policymakers are changing strategies, even state laws to fight opioids, but too many people have been and are battling addiction. That creates drug abuse treatment challenges that can no longer be ignored. Southlight Healthcare is one group that helps people get the treatment they need to reclaim their lives and survive.
Southlight is an organization that specializes in substance use disorders. We've evolved to treat the whole person. We see ourselves as using science and evidence-based care to treat not only the substance use disorder, but also all the rest of the person.
As the issues around comorbid diagnoses, people with mental health and substance abuse issues have become more apparent, we put together a program that can treat both the mental health component as well as the substance abuse component.
The more people that we at Southlight Healthcare are helping each day, that makes me happy. That gets me up every day and motivated to rally our staff to be the entity that we want to be to meet this opioid epidemic.
Working in a program like Southlight is that the people that are here at the time that they're here absolutely believe they're going to be in recovery and absolutely want to be in recovery. And so when they walk in the door to seek help, they want something different. They are motivated to change. That's the exciting part that we do here, and see those connections begin to grow again and become alive. That's what people really live for.
Addiction recovery professionals in North Carolina believe everyone should be mindful of how they describe drug abuse, addiction, even the process of recovery or getting clean. We met a gentleman named Donald McDonald. He works to reduce stigmas associated with addiction and recovery, because if words can provide support to someone, how every one of us talk can influence whether or not a person will seek drug treatment.
My name is Donald McDonald. I am the Executive Director of Addiction Professionals of North Carolina. In the helping profession, we've been teaching people to use person-first language now for years. We don't say an autistic or a diabetic. We say a person experiencing diabetes or a person experiencing autism. This places the person first. It's person-first language. The same is for substance use disorder. And this is to take better care of those individuals. It humanizes these individuals and their families. But the exciting thing is it's also impacting policy. Because think about policymakers, think about legislators, think about voters and taxpayers. Solving the substance use disorder epidemic in North Carolina is going to require courageous and innovative funding and policies. And that requires courage, that requires a tremendous amount of political will. We're more willing to do that for sons and daughters and fathers and mothers than we are for objectified things like addicts, alcoholics, and so forth. So the humanizing language makes it so more people come forward asking for help because they don't feel like they're bad people. It makes sure that the help that they receive is better, and policies are starting to change for the positive as well. There's a Native American leader named Don Koyas. He's been a crucial part of the national recovery movement, and he has a saying, if you want to care for something, you call it a flower. If you want to kill something, you call it a weed. So if we want to care for our children, if we want to care for our fellow citizens, it is important for us to to refer to them as something that we want to care about. Our sons, our daughters, our family members, our fellow citizens. They're not things, they're people.
Joining me now are Mike Causey, Insurance Commissioner, Bob Schermeyer of the SBI, Josh Stein, State Attorney General. Gentlemen, Operation Medicine Drop. Now we've finally gotten to a program that anybody can participate in. Mr. Causey, how did Operation Medicine Drop come about?
Well, my office oversees Operation Medicine Drop. It's under Safe Kids North Carolina. It was first created here in North Carolina under the Department of Insurance in 2010. And since 2010, the numbers that I've seen, that statewide, we've collected close to 90 million pills off the streets. And that's a big deal for the people of North Carolina.
Mr. Schermeyer, the SBI is involved with this.
Correct.
We were talking in the green room. I said I thought it was big time cases with the SBI, agents. But how does your team mesh with Operation Medicine Drop?
Well, we partner with the Department of Insurance and also with local departments across the state, both sheriff's offices and police departments. We put out receptacles and collect pills and other paraphernalia at these locations. And last year, 2017, I believe we collected around 48,000 pounds of drugs.
So millions of pills, tons of medicine off the streets. How does it work? How can my family and friends participate?
Well, this is basically a consequence of the overprescribing we were talking about earlier. That people get a prescription, they use a couple pills, and the rest go in the medicine cabinet. Folks would not leave a loaded gun in their medicine cabinet, but these pills are so addictive and so dangerous, and they're killing so many people. They have to think of it in that type of danger, and so. If there's one thing that your viewers can do to fight this epidemic, it's to get the leftover pills out of their house and safely disposed of. Every county in the state has a permanent drop box, at least one. Many of them have multiple, and they can go to my website to learn where those are, ncdoj.gov/RxTakeback. But what's great about Drug Takeback Day with Operation Medicine Drop with the Commissioner is this is one day where we go out there and we really do a lot of public education. And last fall, we took 13 tons, 26,000 pounds off the street in one day. It was a remarkable development.
Commissioner Causey, those pills are still good, even though they were prescribed a year ago. If you get an ache or a pain or a cough, the doctor gave it to me then, it's still good to take now, right?
And they're still deadly too. And one of the other partners we partner with are River Keepers, the River Keepers Alliance, to try to keep these pills out of our rivers and streams. So, we have, as the Attorney General said, we have permanent drop boxes all across this state. Year-round, people can drop off prescription drugs, but when we do these statewide efforts, that is a big push from every county, from local law enforcement, through SBI, the Attorney General's office, the Governor's office, all the programs under the Department of Insurance. Our fire departments get involved. So we just want to make the public aware of Operation Medicine Drop. And there's more information on all of our websites. ncdoi.com has a whole list of some of the drop sites and so forth. But it's very important that people tell their family and their friends and their neighbors about Operation Medicine Drop and clean out those medicine cabinets and get rid of those old prescriptions or unused prescriptions to keep them out of the hands of people that might cause harm.
What does it look like? Do I go in any drugstore? Is there a box there that says Medicine Drop? Do I hand it to the pharmacist and say, please throw it away? Mr. Schermeyer?
Yeah, mostly these are located at police departments and other government facilities. So police and sheriff's offices.
So I've just assumed they were at the drugstores.
Well, some drugstores do.
Yeah, the Walgreens and CVS and some of the locals, they've started putting them in, and we commend them for that. There are more at the police and sheriff's. Those are the permanent ones. But on Operation Medicine Drop, we go to malls, we go to drugstores, and we publicize where the locations are so that folks can come. And it's March 24th, I believe. That's going to be our big spring day. So folks should definitely pay attention. March 24th, it's a great opportunity to really take a huge risk out of your home. Nobody wants to live with the consequences of addiction, and It's a simple act that we can all take to keep people safe.
You show up at the sheriff's or the police department, Mr. Schermeyer, and you say, I want to drop off some medicines. Do you tell people, because some folks are nervous about bringing that to police attention for obvious, we're talking about opioids in this program, for instance.
Right, all anonymous. There's no recording. They're permitted to drop it off and leave without question.
It looks like a mailbox.
Yep.
And you just drop it in there and go.
They're in most sheriff offices. You just walk in, drop them in the box.
Yep.
It's easy, it's anonymous, it's free, and technically you can do it year-round, right, Mr. Causey?
That's correct. If you miss the date of the big statewide push, you can do it anytime.
Oh.
And many of these sheriff's departments around the state, they're 7 days a week, 24 hours a day. Some of the police departments and other local offices are during the week, during business hours. But, you know, check it out. There's information out there on all of our websites that'll give you the dates and times of some of these locations.
You will make a difference by participating in Operation Medicine Drop. So take your unused or outdated prescription medications to your drop-off location, which ensures it never circulates on the black market. Visit ncchannel.org for links to information about this program. Operation Medicine Drop is safe and anonymous. And for deeper information you can find on Operation Medicine Drop and a host of other safety issues, visit the North Carolina Department of Insurance's website, www.ncdoi.com, ncdoi.com. Final thoughts on this issue. You can come at it from insurance, from health policy.
Well, everybody has a question about insurance at some point or another, so they can always contact our office for any questions. And this Operation Medicine Drop that we talked about is a big deal because it touches every community across our 100 counties in North Carolina. So we want people to be aware of Operation Medicine Drop and the different partnerships we have with Operation Medicine Drop and how they can get rid of their old prescriptions, clean out their medicine cabinets, and make our streets safer.
From a customer service perspective, say someone does want to drop off medicine anytime. You say earlier, safe, anonymous.
Correct.
And those drugs are gone. What happens to them?
They're collected, and then we collect the entire state's collections and we incinerate them.
So the drugs are burned, they can never cause harm again. Do you see the program expanding?
I think that we'll continue to increase the number of locations and probably increase from 2 to some other number of collections throughout the year. With 48,000 pounds, that's a lot of drugs to collect.
And very quickly, Mr. Causey, this is 365. Just because we're having a special drive right now, you can turn in drugs anonymously anytime and get rid of them.
There's permanent drop box locations all across this state. Primarily are sheriff's departments and police departments, but other locations too. And some are open 7 days a week, 24 hours a day.
So just don't let it sit there. If you don't need it, get rid of it. Finally, tonight we go to the man himself, William Baxley. Tell me about opioids in conclusion, your final thoughts. What don't people understand about this class of drugs?
My final thoughts would be simply this, that we need to be aware that this is a national crisis and it affects all of us on every level. It's not an issue of big city, inner city, like we used to think of heroin addiction. This is a local problem. We are actively working investigations in the top private schools in the state of North Carolina. It affects all of our neighborhoods, all of our kids, and it's something that we should be aware of and should educate ourselves on and understand what we're facing here in this epidemic, in this crisis, and what we can do to help, and everyone can do something to help on every level.
Well, thank you, gentlemen, for being on. Very informative topic. Visit our website at ncchannel.org. If you've missed any of the email addresses that you've seen on this show, even the phone number we've offered, don't hesitate to call or write anyone. You can even write the commissioner.
Right.
They're here and they're sharing their stories to raise awareness because you should know there's help for you if you're addicted, there's support for you if you're there trying to help someone who is affected by substance abuse. We'll also have a lot of details on Operation Medicine Drop. Getting those old drugs out of your house can really make a difference. That's our program. Thank you so much for watching.
A Crisis, North Carolina's Opioid Battle is a production of the North Carolina Channel in association with the North Carolina Department of Insurance.